Hello everyone, I am Dr. Shwetha Ashok Harnal and I am a fertility specialist at GarbhaGudi IVF Center, Jayanagar branch. So today let us understand what are the causes for implantation failures. So we often see that in spite of our best efforts, the success rates in the embryo transfer cycles is not 100%. So what could be the reasons for this implantation failures? First and foremost is the age of the patient, like more than 35 years of age or more than 40 years of age. Whenever the age has advanced, the implantation rates also come down. And then the second most important factor is the embryo quality. Sometimes we see that with age, with less number of follicles, with low virion reserve, the embryo quality is usually poor. So if the embryo quality is poor, then the implantation rates also get affected. The third important reason is if the embryo is genetically abnormal. So without testing, it is very difficult to know if the embryo is normal or not. Sometimes if the embryo is abnormal, which is attributed to any genetic disorders in the family or genetic disorders in the couple, the embryo transfer result might come negative. Third most important cause is the immunological causes. What normally happens in the body is the immunological adjustment is done whenever the embryo is ready to implant. But in few patients where there is some autoimmune disorder, or there is some kind of immunological problem, the embryo is rejected in a way that we fight infection. If the immunological factors have, there is exaggeration of these immunological factors, the body rejects the embryo and that might result in implantation failure. Fourth most important cause is the receptivity of the endometrium. So the uterus has a lining which is known as endometrium. So we do this embryo transfer after we find that the endometrium is optimal for an embryo transfer. But sometimes the time when we put in the embryos, that is the normal timing for everyone, sometimes we see that if the endometrium is not receptive at the time of putting these embryos inside, the embryo transfer result might come negative. So these are the few main causes where the embryo transfer result might come negative, and we have necessary tests to overcome all these reasons so that our next embryo transfer gives us a better result. So there are tests to test the embryos like PGTA, that is pre-implantation genetic testing. There are tests to know whether there is the endometrium is receptive or not, that is called ERA, that is endometrial receptivity assay. Or there are immunological testing also that we can do to know if there is immunological problem that is causing the implantation failure for the patient. So whenever we evaluate all these factors and do the embryo transfer in the next cycle, the chances of pregnancy become very high. So whenever there is implantation failure, there is no need to panic, because there are advanced tests that can take care of the reasons for that implantation failure and give us positive results. Thank you.